Good afternoon, everybody. I'd like to welcome you all to today's lecture on psychotropic drugs. The objectives of today's lecture are to identify the effects of benzodiazepines and LSD poisoning. You'll also learn about the management of these poisonings, and lastly, you'll also see into the forensic significance of these poisons or drugs. So coming into definition of a psychotropic drug, a psychotropic drug is a chemical substance that changes the brain function and results in alterations in perception, mood, consciousness, cognition, and behavior of a person. This is a very simple definition in which you will have to focus on the font in red, which is changes in brain function and alterations in these 5 factors of a person. The psychotropic drug is further categorized into antipsychotics, antidepressants, mood stabilizers, anti-anxiety drugs, and lastly, stimulants. So when we look into the developed world, in comparison to ours, the poisoning with medicinal compounds is very common, and psychotropic drugs are also one of them. It is usually because of the state-sponsored health services which provide the drugs with a lot of ease, it is easily accessible, and the cost may be minimal or absent. This is the sole reason why people, the incidence of poisoning with these drugs are really high in their country as compared to ours. So first, we will be talking about benzodiazepines. When we talk about benzodiazepines, we also have to remember this picture, which is a picture of the scientist who first synthesized benzodiazepines in the year 1955, and the name of this person was Leo Sternbach. Benzodiazepines are the compounds with sedative, anxiolytic, and anticonvulsant properties. It is usually used as medications for anxiety, GTCS or generalized tonic-clonic seizures, and insomnia. It is also used in general anesthesia, used for sedation prior to surgery or diagnostic procedures. It is used for muscle relaxation and also in cases of alcohol withdrawal and drug-associated agitation. The forms in which the medication is available are the oral ones, the sublingual, and it is also available in the form of injections or injectables. Benzodiazepines can further be classified into hypnotics, anti-anxiety, and anticonvulsant classes, in which diazepam, midazolam, lorazepam, alprazolam, and clonazepam are examples of some of the really commonly used drugs in clinical practice. So what is the mechanism of action of benzodiazepine? What does it do? So we can just remember the word, the font in red, which you can see in this paragraph, which is GABA. GABA is the major inhibitory neurotransmitter in our central nervous system, and this is where the benzodiazepines are going to work. Now, the major CNS action of benzodiazepines is by increasing the efficiency of GABA. Whenever the efficiency of GABA is increased, there is an increased inhibitory action, which to decrease the excitability of neurons in the nerve regions is very useful. So these regions include cerebral cortex, hypothalamus, amygdala, brainstem, cerebellum, and spinal cord. This is where the benzodiazepines work. So what it does is, it reduces the communication between neurons and therefore has a calming effect on many of the functions of the brain. The adverse effects of benzodiazepines, however, include dizziness, lassitude, vertigo, disorientation, increased reaction time with muscle coordination. It also causes weakness, blurring of vision, and dry mouth, along with urinary incontinence. In cases of severe poisoning, when there is an overdose of benzodiazepines, what we can see is prolonged deep coma or deep psychic coma, respiratory depression along with hypothermia. The patient can undergo or have bradycardia and finally cardiac arrest. So this is a picture summarizing the effects, or rather side effects of benzodiazepines. Starting from the eye in a clockwise direction, we have yellowing of the inner eye, which means icterus, which is a symptom of jaundice, sign of jaundice. Dry mouth with increased salivation. Seizures can also occur, especially when there is withdrawal. Weakness and problems with coordination can also be seen. Stomach problems are other common side effects, along with weight changes, severe skin rashes, memory problems, confusion, hallucination. There can be changes in sex drive or libido, changes in appetite and sleep disturbances, along with dizziness, irritability, talkativeness. The person can become drowsy and lightheaded also. These are some of the side effects of benzodiazepine, which is very much easier to retain when you look at the picture. So it interacts with other drugs also. First being the alcohol. Now what it does is it synergizes with the alcohol and other CNS depressants, leading to excessive impairment. Alcohol itself is a CNS depressant, when taken along with the benzodiazepine to have a profound effect, depressive effect. On the other hand, cimetidine, isoniazid, and OCTs, or oral contraceptive pills, have shown to retard the benzodiazepine metabolism. How do you treat the people who come with benzodiazepine overdose? The first mainstay of treatment is ABCDE. That is, A is for airway, breathing, circulation, disability, and exposure. The level of consciousness of the person can also be assessed by using a Glasgow-Coma scale, in which you look for the eye-opening response, verbal response, and motor response. Artificial lung ventilation has also proven to be useful in management of these cases, along with fluid resuscitation, and sometimes atropine is also used in these cases. So flumazenil is the competitive benzodiazepine receptor antagonist, which is the antidote for benzodiazepine overdoses. But it can also cause seizures and cardiac effects. And in general, the risk of flumazenil outweighs any potential benefit of administration. When you use it, the risk is higher than the benefit. So if the full airway is protected, a good outcome is expected. The flumazenil administration is unlikely to be required. Dose of flumazenil is 0.5 mg IV over 30 seconds and further 0.5 mg over the next 30 seconds. So the medical legal significance of benzodiazepine is, again, it can be accidental, it can also be suicidal, and it can also be homicidal. The other thing that you have to keep in mind when you talk about benzodiazepine is this is something called a rape drug, which is very much commonly in use. So what happens is a person can have his or her drink drugged with benzodiazepine, and when they consume it, they go into unconsciousness, and what it does is it causes amnesia. So when the person is sexually assaulted in the period of being unconscious, and when he or she comes back to consciousness, he or she will not be able to recall anything that happened. So this is a very commonly used drug for facilitating sexual assault. And I have found a device like this in the internet, which they claim to have invented to check if the drink is drunk or not. So it is a light spectrum, checks the conductivity and temperature of any drink, which is the indicator of presence or absence of any drug in the drink. This obviously is not available in our country. Next, we talk about lysergic acid diethylamide or LSD, and looking into the epidemiology of LSD. In the United States, as of 2017, about 10% of people have used LSD at some point in their life, and LSD was very much popular in the 1960s and 80s, as you can see in the picture. These were the kinds of consumers in that time, in the so-called hippie era. It is also known as acid, microdot, purple haze, and white lightning. and is the most powerful hallucinogen known to man. It is an indole alkaloid derivative, of which other members are psilocybin and psilocin. It can be found in the forms of tablets, capsules, liquids, or blotting papers, but these blotting papers are very much commonly used. As you can see, it looks like small stickers of some sort, but stickers are the LSD blotting papers, and this is how it is used, kept on the tongue, and the effects are to be seen after that. It can also be found in these um, forms, which are the sugar cubes. So these are few forms of LSD which we can find. When we talk about LSD, we also have to know about the person who first synthesized this drug. It was Albert Hofmann in the year 1938 who first synthesized this drug and who was believed to be poisoned through absorption from the fingers. And he was the person who synthesized it, and he was the one who tested it and felt the effect. So this is the paragraph. This is an abstract taken from a paragraph he wrote in response to what he felt after he took LSD. So in the year 1938, it was synthesized, and in the year 1943, in the month of April, Albert Hofmann ingested 250 micrograms of LSD, and it was an intentional ingestion of LSD. The first one was accidental. The second one he intentionally ingested, and this particular day, that is 19 April 1943, is known as Bicycle Day because he began to feel the symptoms or effects of the drug as he was riding home on a bike. So this was the first intentional LSD trip of this scientist. The perception is something of an uninterrupted stream of fantastic pictures, extraordinary shapes, and intense kaleidoscopic play of colors. After some 2 hours, his condition faded away. So this is one of the few experiences he had after ingestion of LSD. In the 1950s, the CIA had a program called MK-Ultra, in which LSD was also used to um, give to the people from whom they wanted confessions, as they believed that this was a drug which was responsible for mind control also. So they tested it on some people, in some with knowledge and in some without their knowledge, and the particular program was called MK-Ultra. And it was sold as a medication for research purposes under the trade name Delicid in the 1950s and 1960s. This is the history of LSD. LSD is the most potent psychedelic, and doses as low as 25 to 50 micrograms may induce profound psychological and physiological effects. But is it used for treatment? The therapeutic purpose of LSD is still not known, and till date it is being used as a recreational drug only. LSD is a drug which works on activation of serotonin receptors. So serotonin, as we all know, is also known as a happy chemical because it contributes to the feeling of well-being and happiness. So when a person ingests an LSD, when there is consumption of LSD, it appears to play a key role in maintaining mood balance. And low serotonin levels have also been linked to depression. So when a person has an LSD, the direct effect is in the serotonin, and serotonin obviously is a happy chemical. So the person feels happy. What are the signs and symptoms of an overdose? It causes an alteration in consciousness resulting in dream-like state. It easily induces laughter and cry. So what happens when a person ingests LSD? What happens within a few minutes? A person can feel tachycardic, hypotensive, pupillary dilatation can also be seen, and tremors can take place. So after 30 minutes of ingestion, a bizarre and conflicting perceptual and mood changes can be seen in the person, along with visual hallucinations and simplifying. The mood is extremely labile, and a person can also have paranoid delusions. And A flashback in which effects of LSD may be re-experienced without further exposure to the drug for several years can also be seen. There is a term called a bad trip, which is a medical emergency in cases of LSD consumption. And in this bad trip, there is a panic episode that may last for 24 hours or more. So the drug disappears from the brain in 20 minutes, but the effects are prolonged and may last many more hours after its disappearance from the brain. This is a picture in which the physical effects of LSD can be seen. The pupils are dilated, there's profuse sweating from the skin, heart rate is increased, tachycardia, nausea can be felt, there is numbness, weakness, and tremors of the muscles, high blood pressure, dryness of the mouth, and the person can also experience increased temperature of the body. So this is a picture in which there is a visual representation of what a person's brain can look like after he or she has had an LSD. And these are the ones. The bottom 4 pictures are the depictions of what it might look like. These are the increased activity of the brain that has been recorded. So 1 to 3 micrograms per kg produces moderate effect, and duration of the action is from as low as 1 to as high as 56 hours. 20 to 100 micrograms per kg produces profound effect, and the fetal dose of LSD is 14 mg. When a person comes to the emergency room or to you with symptoms of LSD overdose, the first thing you're going to do is, like in case of any other poisoning, you have to look for ABCDE. You have to secure the airway, breathing, and circulation, and fluid resuscitation can also be done. And as an antidote, chlorpromazine can be used in treatment of LSD overdose. Medical significance includes not the effect of the drug itself, but a drug-induced behavior that can result in trauma. And suicidal and homicidal tendencies can also occur when a person ingests LSD. Having said that, we have come to the end of this lecture. If you have any questions, please feel free to answer or ask. Thank you.